Yes. HDR like it.
I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Father, thank you for drawing us here today. Just pray that you would guide our words, thoughts, and deeds. In Jesus' name. Amen. Good morning, everyone. Nice to see everybody. Mel, can we have a roll call, please?
Commissioner Mason,
Here.
Commissioner Apes,
Yes, here.
Commissioner Turnbull,
Good morning, here.
Commissioner Hinkins,
Here.
Commissioner Van Alstine,
Here.
Commissioner Aaron's,
Present.
Commissioner Levanway. Here. Commissioner Chamberlain.
Here.
All right, would anyone like to add or remove any agenda items? Hearing none, we're going to move on. Review and approval of the meeting minutes from June 4th. Anyone like to make a motion there?
I'll
I'll
make
make
that motion.
I'll support.
Moved by Mr. Van Alstine, supported by Mr. Chamberlain. All in favor, say aye.
Aye.
Any opposed? Hearing none. Good. Public comment, ladies and gentlemen, you will have 3 minutes if you'd like to address the Board of Health. We'd ask that you step to the podium, state your name and where you reside. And you'll get 3 minutes. I'll give you a 30-second courtesy notice that your time is about to expire. Make sure your mic's on too, please.
Hello. I think you can hear me.
Yes.
Yes.
My name is Tracy Skinner, and these are not my comments. I'm reading some comments on behalf of my coworkers that were not able to be here. This is from Cheryl Green. She's a public health technician in Emmett County. I've been with the health department for 26 years, and in November 2024, I will have maxed out on the pay scale within my role for 20 years. There are others in the same situation as I am, so we count on the cost of living as our only chance for a wage increase. I hear in a lot of meetings how important it is to try and retain staff in the upper levels. Anytime you lose staff, there is cost in hiring and training new staff, no matter what pay level they are. It should be just as important to retain staff at the lower pay levels as it is the higher ones. One way to ensure this is making sure we all receive a decent cost of living adjustment. As we cannot ask for a COLA that is more in line with the increased cost of living, the additional days between observed Christmas and observed New Year's holidays would help offset this, along with boosting morale and retention. The next comment is from Scott Johnston from Otsego County. To the board, thank you for listening to my comments and observations concerning the Compensation Committee recommendations. I have worked for 3 health departments over 36 years, 24 of which are with this agency. All have been small, personal, and good to work for, and all have the common hardship of retaining and recruiting employees. I know this committee has worked hard to run comparisons with other entities in the state to remain competitive, and we have been. However, we are losing seasoned employees. We have lost nursing staff to regional hospitals and doctors' offices. Recently, we lost 2 environmental health staff to the state of Michigan's Environment, Great Lakes, and Energy. It took 2 months to fill the environmental health position lost to Eagle, really disrupting the type 2 program in which we have the 4th largest number of type 2 wells in the state to monitor at almost 500. I would like to see the proposed package presented approved so we can continue to retain our seasoned staff and recruit new experienced staff. We are on the cusp of remaining competitive. Qualified hires are hard to find, expensive to recruit, and time intensive to train. I think this proposed package is a good fit for retention and recruiting of employees for the whole agency. Thank you for your time and consideration. Scott Johnston.
Would anyone else like to address the board? Okay, hearing none, we're going to close public comment. Moves us on to staff reports. Mr. Thorell.
Yes, good morning.
Good morning.
Morning.
Okay, So my report for this month, I just wanted to report about succession planning that, we went through a training a few months back with Cameron Consulting, Cindy Cameron. She worked for the Michigan Public Health Institute for many years, and then now does consulting on her own, and does these workshops around the state. So all the leadership staff from here and Benzie Luna District Health Department participated, and basically looking at succession planning. It fits in with our strategic plan. One of our strategic direction number one, actually, fostering excellence, engagement, leadership, and resiliency in a highly skilled workforce is, that's basically what this fits under. And the timeline that was initially developed in the strategic plan indicates that succession planning will be implemented by October. And we're on track with this. But it is an ongoing process, and just want to continue to do that. At the last meeting, I talked about workforce development. This kind of dovetails with that. Just looking internally about, who are the future leaders within the agency that we can work with to bring up to that level. And this is looking across all of our division org charts and whatnot. But really the basic process is to assess the need, kind of looking at, who is going to be here in the next, 3 to 5 years, or even looking 10 years out. What does that look like? And identify a diverse pool of potential leaders. And this really, like I said, kind of starts with looking at our organizational chart and just trying to make those identify those professionals and those staff that are in those roles, and who may be, based on their evaluations and whatnot, who may be interested into moving into leadership positions, whether it's, coordinating projects, supervising, or, a future director or health officer someday. So, as you do that, you kind of determine what their professional development needs are when you identify those individuals. And then you work with them to kind of personalize a career development path and give them the tools and opportunities to be able to basically get the training they need, and things of that nature, and just provide the room for growth. And as I kind of detailed here, I won't go through line by line in this report, but there's some interesting, things that you can do, when you're looking at leadership potential, and, who those people are. And there's a chart I have in here that kind of identifies potential from low to high, low, moderate, high on the left side. And then on the bottom, you have performance, low, moderate, and high. And then up in the upper right-hand part of the chart, you're looking for the, high potential, solid players, superstars, and top performers that kind of align in this chart here. And, I don't want to discount anybody that, may have the lower potential, because that's what they, aspire to and what they want to do, because they're happy with just coming in and doing their work, and kind of being that workhorse professional, that, staff person that just comes in and wants to do their work, and not aspire to those leadership roles. And that's fine. And we just want to, recognize that and acknowledge that. And then, work with them in other ways to kind of develop them as well. So one of the things, we're looking at when we're looking at leadership roles, are what are the most important functions of the job? What does it take to be successful? What characteristics distinguish the excellent from the average for this position? And then, other observations that you may have for individual positions. But, as we go through this, it really builds leadership capacity, develops new skills, increases a sense of belonging, improves communication, and boosts morale, and develops trust. But one of the key things, I have another chart in here that kind of lays out, what the biggest impact that you have in formal training. It only accounts for about 10%. Feedback and coaching from leaders to staff through evaluations, mentoring, and relationships is about 20%, but the biggest impact is 70% on the job experiences and development in the role. So what that means is, basically, once you've identified individuals that are kind of tracking towards those leadership positions is to, delegate some duties to them, let them kind of dip their toes in the water, so to speak, to see what it's like. And give them special projects and tasks to just kind of let them use their skills and kind of develop along the way. So, that's about all I have on, succession planning. Does anybody have any questions about that? Okay. Just some highlights from June. So we did, as you recall, we did break out school health into its own division, which broke up the previous community health division, and then we basically reorganized community health and added some other duties under that, including the lab and community connections, which were under environmental health and family health, and some other things like communications. But anyways, we went through the hiring process, and I'm happy to report that Janine Pung was named Director of Community Health. You all know Janine as her role as a Public Information Officer and Marketing and Community Outreach. So as in community health, communication is a key aspect of that. It was a good fit for Janine, and she has the skills not only from her time here at the health department, but going back into her previous experiences in the private sector. So welcome, Janine. And then just wanted to just give a brief update, since last time I think Commissioner Turnbull was asking about the grant that we applied for from the Office of Highway Safety Planning. We have passed the first stage of this. We were successful of being, basically elevating us to the second stage, which we haven't actually formally gotten the grant yet, but this is a very good sign. And so, we'll be continuing through that process, and we'll give an update to the board, as we move forward. So I'm expecting that we will be receiving the grant. I think typically once you pass that first selection phase, then you kind of get into the nitty gritty where they're really looking at your plan and working with you. So I'm expecting that we'll receive it, but it's just not official yet. So that's all I have.
Anybody have any questions for Dan?
Mr. Chair.
Go ahead, sir.
Commissioner Turnbull, could you use or turn your mic on, please? Thanks.
Testing. Got it. Okay. And just for the sake of the board, earlier this week, I spoke with Mr. Thrall about the appeal process, because I'm not very knowledgeable on, just the process itself, what's going to be taking place. And I was wondering, Dan, would you be able to just inform the board with the same information you told me, kind of the overall process, how long it'll take, what we're looking at, and the financial implications or aspects to the HDNW?
Sure. I'd be happy to. So Commissioner Turnbull had called me and had some questions about the appeal process. So as you recall, the Iron Pig has filed an appeal concerning Section 2451 of the Public Health Code, which is one of the ones that was upheld by the judge in Otsego County. So at the 46th District Court, Circuit Court, sorry. And he just had some questions about what that looked like timeline wise, and how much I thought it would cost, and really thought maybe we should have the attorney here at this meeting. But when I would talk to Commissioner Turnbull, basically we have some experience with the appeal process with some other lawsuits that we had, namely the Let Them Breathe lawsuit, which also originated out of Otsego County, and then the Concerned Parents for Emmett County, which had to do with the mask mandate lawsuits. So in those cases, it took about 6 months to actually even be heard at the appellate level at the Michigan Court of Appeals. And during that time, really all the costs were incurred at the lower court level, as far as like the lawyers putting together their briefs and whatnot. Now, when you get into the appeals court level, they do review those again and make sure they're up to speed with their briefs, because it's been, like I said, like 6 months since the last time it was heard. And so there are some costs, attorney fees, just basically their time and whatnot, and then, filing fees and things of that nature. But our experience is it's been not any more than about $5,000 when you're at the appeals court level. Where it's much more expensive at the lower court level when they are actually putting those briefs together. And it is at the Michigan Court of Appeals, I mean, basically they go in, they do their oral arguments and that's it. I mean, it's like done in, half hour, 45 minutes. And then you just basically wait for the panel of appellate court judges to render their opinion, and you get that opinion back. And then, basically you do have options either side to, advance to the Supreme Court, but then there's, filings and things of that nature. And then the Supreme Court actually decides. It's not a foregone conclusion that they're going to hear your case. They have to actually decide if they're going to hear your case. So, yeah, the costs at the appellate level are much less than at the lower court level. So I don't know, does that answer all your questions that you had, Commissioner Turnbull?
Yes, that answers mine. Thank you.
Okay.
Anybody else have any questions for Dan? Okay, does anybody have any questions for any of our directors based on their written reports?
And if anybody has any questions about, Jeremy's not here, he's on vacation, lucky guy. So if you have any questions about beach monitoring, I'm happy to answer those.
Okay,
Is
hearing none?
Hold on, Scott.
Chairman,
Sorry, go ahead.
is the beach monitoring, is that done by the health department, or is that got volunteers involved to actually go to all these different beaches and grab samples or?
Well, we would be happy to accept volunteers to do that work. We do actually have staff that we have one staff person that's a courier for our lab that also does the wastewater sampling, and then in the summer does the beach monitoring. That's Mark Drenth. He's an environmental health technician. And then we actually bring on a few other staff during that time, because we have beaches all over the 4 counties. We have basically about 50 beaches that we do throughout the summer. So quite a few, 30 that we do weekly, and then 50 that we do a couple other times during the
I've
summer.
had a couple of the lake associations mention that some of them people would probably be willing to do samples depending on how they had to do it. So it might pay for the health department to reach out to the lake associations and say, is there somebody that would be willing to volunteer to take them samples, and this is what you have to do to take them? Majority of them, I wouldn't be surprised you'd get a majority of your beaches to be sampled by volunteers for you. Save yourself a whole lot of rigmarole.
Yeah,
Just have to reach out to them lake associations.
sure. That's not a bad idea. We have had lake associations contact us. I mean, they're happy that we're doing the public beaches, but they want to do more, right? They want to kind of sample more of their lakes and whatnot. And they've reached out to us as far as using our lab and doing some work that way. But in recent years anyways, they haven't been able to put anything together as far as, we'll give them the information and say, okay, we have to know, because we're doing all these other beaches, like when you want to bring in samples and, how many you're going to bring and all that kind of stuff. So we are definitely open to working with lake associations, and I will pass that along to Jeremy,
Okay.
at least for next year.
Yeah.
Because we're always, looking for help in that arena. So
Yeah, and they're there all the time, so why not? It's
Right,
easy.
right.
Yep.
Yeah.
Great. Thank
they
you.
just have to get up early in the morning and get the samples to us
Yeah.
in a timely fashion. But
I think Mr. Drenth would be okay if they want to do the sanitary samples as well.
yeah, maybe. Yeah. He can hold their ankles, right? As
Tell me when you've had enough.
Mr.
Okay,
Chair,
sir, go ahead.
regarding that, now, Dan, do you have any updates regarding the sewer septic bills stuff down in Lansing?
Actually, I just received a fourth draft of those bills and I have not, gone through them, in great detail, although I've heard that, that basically it looks like they're gonna try to shift from 5 years to 8 years in the frequency on the frequency of inspections. But there's a lot of other details and I'm not, I've heard different things like, those health departments or jurisdictions that have time of sale programs in place right now, that there may be some grandfathering in there, but I'm not certain, and I don't want to speak to that, that is a definite possibility in there. I actually just started reading through and trying to make comparisons with the fourth draft yesterday, because I just received it, like I said. So more to come on that, and I can
Okay.
give a report probably next month on, what exactly that fourth draft of those bills is looking like. But I do expect that this is probably going to come to the lame duck session in Lansing, is kind of what I'm hearing. But I haven't, I received this fourth draft through someone else and not the bill sponsors who was, we were working with to get comments and everything like that. So I don't know if they're kind of shutting that down and just forging ahead or not, but
Okay, thank you.
Any other questions? Okay, that then moves us to committee reports. Ms. Levanway.
Yes, we went through the May bills and I would like to make a motion that the Finance Committee met to review the bills and employee expenses and would like to make a motion for the full board to approve of the May 2024 bills in the amount of $676,502.62 and the May 2024 employee expenses of $23,921.49.
Second.
Moved and seconded. Any further discussion? Hearing none, Mel, can we have a roll call, please?
Commissioner Aaron's,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Henkins,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Mapes,
Yes.
Commissioner Levanway,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Mason.
Yes.
Motion carried.
Thank you. Then Employee
Okay.
Compensation Committee request.
This was a committee recommendation to make one motion. And they wanted it so that it would be a 3% cost of living adjustment with 3 days off between Christmas and New Year's. And our committee, I approved of it, and Commissioner Hankins wanted more information and wanted it broken out. So I allowed it to go into two motions with the hope that the committee would give us more information, because there was information given on counties and what they gave percentages for some of their union negotiations, which the health department is not unionized. So I'm hoping that the committee will give a presentation and so that everybody's aware of, they can hear what everybody will make a motion on.
okay. I think Tracy Skinner is gonna start and kind of introduce everybody and begin the presentation.
Good morning. Each division of the Health Department elects representatives to the Employee Committee, and this committee acts as a liaison between administration and staff. From that committee, some of us volunteered to be part of this subcommittee on employee compensation, and that brings us here today to this proposal. My name is Tracy Skinner, and I represent the Family Health Division, and I will let my colleagues introduce themselves.
Caitlin Nellis, Family Health. Bethany Lieberman, Family Health. Melissa Purdy, the Administrative Division. Danica Howard, Family Health.
I was part of the subcommittee 2 years ago, which was the last time that the cost of living adjustment was addressed for HDNW employees. And as I look around this room, I believe Commissioner Hankins is the only commissioner that was on the board at that time. Thanks for sticking with us.
I'd like to disclose too that I received a bribe this morning from Ms. Skinner. So That will in no way affect my vote, but thank you very much.
To explain that
You're missing the lime and the rum though.
it was in reference to a conversation afterwards about like the, buy the world a Coke kind of, you know, so, so when we talked last, at the compensation 2 years ago, there were financial concerns related to legal expenses. And after discussion, it was decided there's absolutely no way that we could provide actual cost of living adjustment, and a 3% COLA was the maximum that we would be able to provide. And we asked our employees to essentially balance the budget on their backs, and they did, with the hope that things would be different in 2 years. As we prepared for today, it felt very much like deja vu. Tight finances again, and many flat funded programs, with our colleagues again asking, why are we asking for more? Commissioner Mason pointed out at the committee meeting that the road commission is facing similar challenges and having to do more with less. We would like to thank him for his understanding of the obstacles that we face, which led us to explore other methods of compensation. We've been extensively researching the impact of the proposed 3-day closure between Christmas observed and New Year's Eve observed. These are some of the quietest days for our agency and would have minimal impact on services to the community and our budget. These days would help compensate our current employees and would be an incentive for recruitment. It was extremely helpful to have dialogue with commissioners on June 18th. We hope to continue that dialogue today with the full board. As Danica moves through our presentation, we will pause as needed for questions that arise as we switch slides so that we all might move forward together. There were several requests on the 18th for more information, and that will be included in our revised presentation today.
Thank you, Tracy. Good morning, everyone. On behalf of the entire employee committee and the 169 colleagues we represent, we thank you for taking the time to listen to our fiscal year 2025 proposal. As we all work together to ratify our compensation package, we would like to also thank the Board of Health members on the Personnel and Finance Committee, Commissioners Hankins, Mason, Levanway, and Aaron's, for sharing their thoughts and providing valuable input as we collaborated together to finalize this presentation. With support from our leadership team, our compensation proposal for fiscal year 2025 is the following: a cost of living adjustment of 3% for 2025, and the permanent addition of an office closure with pay for the 3 days between Christmas observed and New Year's Eve observed. Our current policy excludes any staff less than a 0.8 FTE from receiving any paid time off, including PTO and holidays. This proposal is inclusive to all staff, including part-time colleagues. As Commissioner Levanway pointed out during our recent committee meeting, as this board considers our proposal, direct staff feedback is extremely important. We could not agree more and would like to take the opportunity to share with you what our colleagues are saying about our request for a 3% adjustment. There has also been overwhelming staff support for our proposed 3-day office closure, and some of those comments will be shared later in this presentation.
Implementing a 3% COLA helps counteract inflation and ensure that our compensation keeps up with the rising cost of living. Additionally, this adjustment can enhance employee satisfaction and overall well-being by offering more financial stability.
Compensation is one of the most important measures of how employees are valued by an organization. I feel like this package moves in an encouraging direction to help me feel valued as an employee.
I have been stuck at my current spot on the pay grid for many years, and a COLA is my only opportunity to see any wage increase.
At this stage in my life, I do not want to have to find another job, but I also need to be able to afford to continue working here. The federal inflation rate over the last 3 years is as follows: 8% in 2022, 4.1% in 2023, and 3.4% in 2024. We realize that no one has been immune from the crippling effects of inflation. A cost of living adjustment is not a raise, but rather a wage adjustment to combat inflation. Anything less is considered an economic loss to the employee. We applaud the commissioner-led initiatives that were taken on behalf of local public county entities to address unprecedented inflation over the last 2 years. This includes the Antrim County Commissioners increasing the contractual 2.8% wage increase to 4% for the general bargaining unit in 2022, while the Charlevoix County Commissioners approved county employees receiving a 5% increase in addition to the already approved 2% increase. Due to the numerous financial constraints of working in public health, we were not able to request for a similar adjustment. Understandably, a 3% COLA the past 2 fiscal years has not kept pace with inflation. Our team has analyzed the cost of a 3%, 3.5%, and 4% COLA, as well as the additional steps to our current pay grid. After months of discussion with our leadership team, it was determined that the addition of steps to the pay grid would not be financially feasible while still being able to offer COLA to all employees. After reviewing the needs of our colleagues, while also keeping in mind the limitations of working in the public sector, we determined that a modest 3% COLA would be the most beneficial, most fiscally responsible option to pursue. This is in part why it is of the utmost importance to our team that the proposed 3-day permanent office closure receives full consideration of this board. The projected cost of our proposed 3% COLA increase is $428,903 and would be distributed amongst 169 staff members. Working in the healthcare field requires specific educational requirements and skill sets. 70% of HDNW positions require a professional degree, and 54% of positions require professional licensure or specialty certification. Our counties have a limited number of people who meet these criteria. Though we will also be comparing our proposal to other Michigan Health Department compensation offerings in this presentation, the reality is that our agency's main competition remains other healthcare entities within our 4 counties. This is where we live, where our homes are, where our kids go to school, and where we pay taxes. HDNW continues to experience turnover as we repeatedly lose staff to local healthcare jobs with more desirable wages, work schedules, opportunities for incentive pay, bonuses, and compensation packages. At the June 18th committee meeting, there was a request for additional information about where our staff is going when they leave HDNW for other local employment. We would like to share the following 2 examples. One nurse left our Otsego office to work at Gaylord's Veterans Affairs branch. She shared with us that her current compensation is as follows: 5 weeks paid vacation, 11 federal holidays, 4 hours of sick leave accrued every 2 weeks, up to a 5% retirement match, a pension, health insurance, and an opportunity for an annual merit-based bonus. VA employees received 4.5% COLA for 2024. Nurses with an associate degree are eligible for $74,000 to $98,000 annually, and nurses with a bachelor's degree, $94,000 to $125,000. In 2017, a family health nurse left to work at McLaren, Northern Michigan, as they were able to offer a more family-friendly work schedule, and it was less costly for her to pay for 3 days of daycare a week versus 5. This spring, she reapplied for a vacant nurse position in Emmett, but backed out at the interview phase as she would have needed to take an $8 an hour per hour pay cut. The following slides will walk through what is being offered by several local private and publicly funded healthcare agencies. We recognize the monetary constraints of being able to remain competitive financially with these agencies and appreciate the board's willingness to hear our creative strategy to help bridge the gap with our proposed 3-day closure. At McLaren, both full-time and part-time employees are eligible for health, dental, and vision insurance, a flex spending account, and PTO. McLaren offers up to $12,000 in tax-free student loan repayment, shift and weekend differentials, and additional pay based on degree level. Full-time employees get straight holiday pay if they don't work the holiday, and 2.5 times pay if they do. McLaren also offers a 403B and a Roth with an employee match. McLaren offers 2 McLaren Health Advantage PPO health plans, as well as a Blue Cross Blue Shield traditional plan option to employees who live outside the McLaren Health Advantage network area. The employee monthly premium for full-time employees on the McLaren Health Advantage premium is 17%. We would like to share several current McLaren Northern Michigan recruitment incentives from active job postings. Social work care manager offering a $10,000 sign-on bonus. Medical surge RN offering relocation reimbursement, on-site daycare, and student loan repayment program. Graduate nurse offering a sign-on bonus up to $20,000. Munson offers medical, dental, and optical insurance, paid holidays, and paid time off up to 19 days your first year. Tuition and reimbursement and ongoing educational opportunities, retirement savings plan with employer match, and personal financial consulting. They offer employees the flexibility to choose the benefits that work best for the individual and their families. Munson nurses settled on a 3-year contract in 2023. The deal with Michigan Nurses Association includes wage increases of nearly 16% over 3 years. The most experienced nurses will make over $50 an hour by the 3rd year of the contract, in addition to those retention bonuses. In May of 2023, Munson Medical Center announced it is offering free furnished housing for a year for operating room nurses and surgical techs, or a $10,000 signing bonus for those positions. We would like to share an excerpt from a press release regarding this creative effort to address recruitment and retention. The job market is incredibly competitive in healthcare. As a rural system, we decided we needed to do something interesting to attract people who might want to have a career here, says Megan Brown, Chief Marketing and Communications Officer at Munson Healthcare. The Michigan Health and Hospital Association said it is unaware of any other hospital in the state providing free housing for permanent hire nurses and other health workers. We're trying this creative, innovative approach to stand out in the healthcare career marketplace, Brown says. We would also like to share 2 active job postings showing Munson's current recruitment incentives. Emergency Department RN in Gaylord offering a sign-on bonus up to $7,500. Behavioral Health Counselor in Grayling offering a sign-on bonus of $10,000. We applaud Commissioners Mapes and Chamberlain for their efforts and advocacy in serving on the Bay Bluffs and Grandview boards and appreciate the support and leadership they continue to provide to staff here at HDNW. As of 2022, Bay Bluffs CNAs received a 37% wage increase, while RNs received 7.8%. Bay Bluffs currently offers a $5,000 sign-on bonus for RNs and CNAs, a student loan repayment up to $5,250 per year paid directly to student loans for RNs, and additional $3.20 per hour through September of 2024, shift and weekend differentials, and paid license renewal fees. Employees are offered an employer-funded retirement plan, 401A, with an 8% employer contribution, and a 457 retirement plan is available upon hire. Excuse me. Grandview RNs can earn up to $46.17 per hour through base pay and additional base pay plus an additional $3.20 through September 2024 and $1 per hour bonus through December of 2024. and shift differentials up to $5 per hour worked. Grandview offers a facility paid retirement plan and Blue Care Network insurance. Single coverage is available at no cost to the employee. Double and family coverage is also available. HDNW cannot compete with the numerous financial incentives offered to employees of these facilities. We cannot offer massive sign-on bonuses, and we certainly cannot afford to pay for employee housing. We understand that our agency is not able to offer shift differential incentives to staff due to the limitations of our hours of operation. However, the reality is that with sustained inflation and financial burdens to our staff, HDNW is at continued risk of losing employees to agencies that are able to offer more financial compensation opportunities. We strongly feel that we need to be competitive in order to retain the staff we have, and to remain a contender for recruiting new staff in our limited and challenging local healthcare labor market. The day after our June 18th meeting with the Personnel and Finance Committee, one of our employee committee members received this external recruitment email. We thought this would be a great opportunity to show you how our staff is continuously being actively recruited by outside agencies. This email details travel nursing opportunities in both the UP and downstate at several corrections facilities. The pay being offered for these positions is listed as $2,653 per week. Emails such as this have become increasingly commonplace to ourselves and our colleagues as the healthcare shortage continues to grow. As we prepare to shift our focus to comparisons to other Michigan health departments, you might be starting to wonder, what makes us stay at HDNW? The reality is that our agency is filled with passionate staff who truly believe in the mission of the health department and in serving the communities where we live. Please help us keep HDNW a competitive place to work so we can retain our quality and dedicated staff. The Personnel and Finance Committee requested that we add information to today's presentation about compensation at other health departments across Michigan. We recognize that there is a variety in health department structures, with some being county specific and others being district health department. Many are unionized while some are not. There are differences in size, geographical area of coverage, agency divisions, services offered, whether the services are integrated for clients, educational requirements for staff, as well as community composition, local taxes, and average home prices. Given these differences, we did notice one common theme. Each health department has a compensation package suited to meet their unique needs of their employees in the communities where they live. Cost of living adjustments were approved for every county that responded to our request for information. Approved cost of living adjustments for 2024 are as follows. DHD2, 5% with 4.45% for 2025. DHD4, 5% with 4% for 2025. Grand Traverse Health Department, 4%. Ionia Health Department, 3%. Kent County, 5%. LMAS Health Department, 3%. Mid-Michigan Health Department, 3.5%. And Western Upper Peninsula Health Department, 5%. Ottawa County Commissioners gave their health department employees a 6% COLA in 2024, despite facing massive legal expenses and reductions to their budget. They have also already approved a 4% COLA for 2025. In 2023, LMAS District Health Department asked for a 3% increase, and their Board of Health actually instead decided to give them 4%. While our colleagues would greatly appreciate receiving COLAs more in line with what other health departments are offering, we understand that our agency is not fiscally able to do so. Recognizing this, we would like to highlight some current actions of other health departments are taking to respond to retention issues. Many health departments observe all federal holidays, some offering up to 14 holidays, and many offer PTO and holidays to part-time staff. Examples of holiday variances from our agency schedule includes MLK Day, Juneteenth, Veterans Day, a full day on Good Friday, and General Election Day. LMAS is closed to the public every Friday. Staff are generally allowed to get their 40 hours in as they like, so long as the office is covered during office hours. They also have 21 agency vehicles for a staff size of 77. Ionia County Health Department added a 10-year pay grid step in 2024. Muskegon County offers nurses merit increases and 8 steps to the pay grid. In October of 2023, the department implemented a salary study recommendations with 3% increases over each of the following 2 years, in addition to a COLA increases. Staff also received a one-time lump sum ratification bonus of $2,000. Ingham County partners with Davenport University to provide up to $7,000 toward tuition for most undergraduate and graduate degree programs. Washtenaw County employees are given their birthdays off. DHD 10 and Central Michigan DHD offer paid maternity and paternity leave. Kalamazoo offers a defined benefit plan for retirement, which is a 100% county paid. As we mentioned in our presentation to the Personnel and Finance Committee 2 weeks ago, several health departments are already utilizing our proposed 3-day office closure as a retention and recruitment tool. We firmly believe this is the most fiscally responsible option with minimal impact on operations and maximum results. The following list is not all-inclusive, but rather represents the health departments that responded to our request for information and are already implementing our proposed closure. Mid-Michigan District Health Department, representing Montcalm, Gratiot, and Clinton counties. Huron Health Department, Sanilac Health Department, and Tuscola Health Department. The feedback from these agencies has been overwhelmingly positive. We would also like to share that DHD 10, serving Crawford, Kalkaska, Lake, Manistee, Mason, Mecosta, Missaukee, Newaygo, Oceana, and Wexford counties, routinely collaborates with their Board of Health's Personnel Committee. Per their October 2023 minutes, the committee discussed employee retention ideas, including time off between Christmas and New Year's, and shared plans to continue to explore this option. Further, the committee encouraged the full board to bring forth any additional progressive job enrichment ideas. We hope to similarly be able to collaborate with all of you as we address recruitment and retention at our agency. Dan Thorell shared concerns to address our employee turnover at the June 4th Board of Health meeting. Our medical director, Dr. Meyerson, is now the only member of the leadership team that has been in his position for more than 4 years. These positions require advanced education and experience, making them difficult to fill. Turnover over the last 4 years includes a health officer, a chief financial administrative officer, multiple deputy health officers, multiple environmental health directors, a family health director, and multiple community health directors. Of the 169 employees at HDNW, only 37 have been with the agency for more than 10 years. Please keep in mind the financial impact of turnover for our agency as it pulls staff out of their regular roles to train new staff. The table on this slide reflects open vacancies in our agency since November of 2023. Of note, our school health division has 3 unfilled public health nurse and 3 mental health professional positions open. Our mental health professional positions take on average 6 to 7 months to fill. I would like to share a quote with you from an employee in our newly formed school health division. This proposed compensation package is vital for employee retention and employee satisfaction. In the child and adolescent health program, within the past year, we lost 4 potential candidates for mental health professionals due to our salary offer being too low to meet their needs. It takes a considerable amount of time and effort to recruit good candidates and then to train them to be efficient in their jobs. If we could be more competitive in not only our wages, but in non-monetary benefits, such as time off, it would help with our ability to secure qualified candidates and then be able to keep them. This will create consistency in our program, and this consistency with staff will in turn have a bigger impact, such as improved relationships with our schools and community partners. Staff attrition not only impacts the employees that remain at the agency, but our communities as a whole. I would like to point out a poignant example of the true cost of employee turnover. Last summer, the entire Otsego County Family Health Nursing staff turned over, with the exception of 1. This resulted in a significant loss of services for families with young children in Otsego County for several months, as shown in the provided table. The stark contrast between summer 2022 and summer 2023 visits for Otsego County speaks volumes, as the number of maternal infant health program visits dropped from 100 to 57 for June, 97 to 26 for July, and 96 to 47 for August. Our communities deserve consistent services via an adequately staffed health department. As members of the Board of Health, we are asking for your support in addressing these staff retention and recruitment concerns. There are many factors outside of all of our control regarding public health funding limitations, but supporting and approving this proposal is something that can be done today to make a difference. Staff feedback for our current proposal has been overwhelmingly positive, and our leadership team is in full support of our proposed 3-day closure. We appreciate you looking at this through a creative lens. This is also an opportunity for you to not only support our proposal and advocate for our staff, but to bring this innovative retention concept back to your individual counties. The proposed 3-day closure would have minimal impact on operations. We are always available to meet our community's needs. It is our agency's practice to provide after-hours on-call coverage, and the executive team rotates that responsibility each month. Community calls are routed directly to the on-call employee's cell phone when the office is closed, including evenings, weekends, and holidays. And the on-call employee knows who to call for immediate assistance. Some recent examples include responding to a bat encounter, a tuberculosis case, and a dental emergency. These calls have resulted in the community members being connected to the resources they needed within 20 minutes. We also have staff who are expected to respond in an emergency, including nurses and public health techs in communicable diseases and immunization programs. For example, regardless of the time of day, staff must respond if a sensor indicates a concern with the temperature of stored vaccines. As many of our staff are salary, employees are expected to be available at all hours and do not receive any stipend or overtime pay. In our June 18th meeting with the Personnel and Finance Committee, the importance of the health department being available in an emergency was discussed. Our entire staff's comprehensive response was evident back in 2020 and 2021, though much of our work wasn't outwardly visible to the community. All staff immediately pivoted and balanced their standard roles with new responsibilities. Our colleagues worked after hours, weekends, and holidays, performing tasks such as contact tracing, answering the public health information line, testing, and wastewater sampling. We are public health, and that responsibility never shuts off. In 2023, the agency had limited clinics during the 3 days between Christmas observed and New Year's Eve observed, which included 4 WIC clinics, 1 full day and 2 half-day immunization clinics, and 1 half-day sexual health clinic spread throughout our 4 counties. These clinics were not scheduled to capacity, and per the family health director, there were a significant number of no-shows this week for our clinics. Taking this into consideration, clinics can be easily scheduled the days immediately before and after the proposed closure to meet community needs. From the perspective of our home visitors, the vast majority of the families we serve ask not to have visits this week or end up canceling last minute, stating that they want to wait until after the holidays are over because they are busy and want to spend time with their families. There is a minimal impact on environmental health services. There are very few permits this time of year because you can't dig in the winter. Water samples would not be taken during this proposed 3-day closure. However, during the holiday weeks as they currently stand, depending on how the dates fall each year, the agency may only accept samples for 1 or 2 days anyway. Our agency does not accept samples on Fridays, and by the following Monday, the agency wouldn't have results yet. Wastewater samples would not be taken this week, however. Please keep in mind that the schools are closed this week, so there wouldn't be any samples from them anyway. For biological samples, the agency is prepared to provide ample public notice that the offices will be closed this week. Many community health staff are based in schools which are closed this week. The other community health programs are typically very quiet these 3 days, with staff using their time for prep work. As an example, for the child and adolescent health centers, in the time frame of our proposed closure, there were only 3 visits provided in 2023. Administrative staff would not see disruption during this proposed closure, and the front office staff would be responsible for posting signs indicating that the agency is closed. Our committee is passionate about the addition of the 3-day closure to HDNW's compensation package, as we believe this unique concept will not only help compensate for our limited ability to adjust for the true cost of living, but will also make a significant impact on our staff retention and recruitment crisis. We thank you for taking the time to listen to our presentation on behalf of our coworkers, but I believe their own words truly say it best.
Having the time off between Christmas and New Year's would be so beneficial to my family. As a mom of 2, I want to spend as much time as I can with my family. My children's daycare closes for over a week for Christmas break, so I typically have to find alternative childcare for them or take PTO. Furthermore, it is not guaranteed that I can even take PTO around Christmas and New Year's because the nurses have to take turns having this time off to ensure there is always someone in the office during this time. Having time off agency-wide will both guarantee that I have that time with my family and lessen the burden of finding alternative childcare.
Having the 3 days off between the holidays would be a fantastic perk that other nursing jobs don't offer. This would make me want to stay at HDNW.
Not all of our staff are able to use PTO for true time off to recharge, but rather some need to use all of their allotted time for medical appointments and to take care of loved ones. This time off would ensure that everyone has an opportunity to take some time off guaranteed.
Providing time off between Christmas and the New Year would allow us time to unwind and detach from work responsibilities, recharge mental and physical energy, enable us to return to work feeling refreshed, focused, and motivated.
Having a work-life balance is important to the quality of our employees' lives. Having time between the holidays gives us an opportunity to spend time with family members that live far away, allowing us extra time to travel.
Having the days off between Christmas and New Year's would be so helpful to spend quality time with family and not have to stress about trying to find childcare over the holiday when daycares and schools are closed.
The fact of the matter is that HDNW has not been able to keep up with the cost of living adjustments over the last few years. Staff have continued to perform at high levels despite not being compensated appropriately. Having the time off between Christmas and New Year's helps me to feel valued and that our agency is listening to employee input.
In closing, we propose a cost of living adjustment of 3% and an office closure with pay between Christmas observed and New Year's Eve observed. This office closure with paid time off between Christmas observed and New Year's Eve observed will be a permanent adjustment to employee compensation. We ask that this proposal be considered in its entirety as intended by our team on behalf of our committee and the 169 coworkers we represent. We thank you for your support.
Thank you very much. That was an excellent presentation.
Thank you so
And the
much.
employees have been absolutely wonderful here. It was very obvious that you're here because you're passionate about the place you work for. On that note, we have two motions in here, so I would like to make the first motion to move to provide a 3% cost of living adjustment for the health department staff to be implemented for the fiscal year 2025. And I need somebody to make a second.
Second.
So moved and seconded. Is there any further discussion on? Trying to find it in here again. Motion number 1 is what you made. Is that correct?
Number 1, yes, correct.
Okay. Is there any further discussion on motion number 1? Your roll call, please, Mel.
Commissioner Chamberlain,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Levanway,
Yes.
Commissioner Mapes,
Yes.
Commissioner Mason,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Hankins.
Yes.
Motion carried.
And I'd also like to make a motion on motion number 2, but I'd like to change the wording just a little bit. It means the same thing. It just takes out spend time with family and friends. And it says, I move that the Health Department of Northwest Michigan close offices between Christmas observed and New Year's Eve observed to give employees the 3-day paid time off for this year. Is there anybody with a second?
Second.
It's been moved and seconded that you have significantly reworded the motion that's
Yeah,
in
you
our
took out
packet.
the 1-year trial period. It's just,
Oh, yes, it's just for this year. It says just for this year at the end of my motion.
Okay.
So it took out, I'm sorry, you're right. I took out to spend time with family and friends and for off for this year. So it's 1 year. It's not permanent. Do you want me to read it again?
Well, I just want everybody to be clear because the motion that's in our packet specifies 3 days and specifies a 1-year trial period, and you didn't include that in your
Yeah, it says
motion.
for this year.
Okay,
So it says to give employees the 3-day paid time off for this year.
okay.
It doesn't say a trial period. It just says for this year. Sorry.
Okay.
It's just reworded to make it sound more efficient.
Okay, there's a motion. Was there a second?
Neil?
Yes. Thank you.
Yes,
Okay.
Chair.
Any further discussion? I have a couple of quick questions. Shannon or Dan, maybe best to answer these. How many current holidays are recognized by the health department, both federal and state?
10.5, I believe.
10 and a half, the half being
Good.
really
the
Good
afternoon-
Friday.
The afternoon of Good Friday is the
Okay.
half. Yeah.
And how many vacation days, personal days, et cetera, are implied? And I'm sure there's a scale depending on the years of service, but let's say for an administrative staff person with 10 years of service,
10 years would be 24.5 days.
24.5 days in addition to the 10 and a half days?
Correct.
And there's not, that's sick time and vacation time together. There's not
Yes,
a separate one for sick time.
that's in total, sick and vacation.
It's accrued, yeah.
Okay,
And
so
how many people do we have that have 10 years?
37.
I believe,
Yeah,
yeah.
37%.
So that's 25% roughly of the employees. Yeah.
Correct. Rough math.
So just to clarify in my brain for a minute. Personal time off includes vacation time, sick time.
Yes,
It's
yeah.
all part of.
It's
the
all
package.
like, yeah, wrapped into one
Okay,
paid time off, yeah.
okay. So that's 35 days for someone with 10 years service. Is that correct?
Correct.
Okay. Okay, any other questions?
Would there have been, say, a higher COLA adjustment asked for without the 3 days?
We have a hard time meeting the 3%. And any more than that, I'm not sure that the agency can afford. I cannot be confident going above 3. So this was the creative solution, if you will, to go
Mhm.
above 3.
Okay.
Any other questions? Hearing none, can we have a roll call, please, Mel?
Commissioner Lebanway,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Mapes,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Mason,
No.
Commissioner Hankins.
No.
Motion carried.
Can I ask a
Okay.
question before we go on? When's the last time you did a salary survey? Or have you ever?
It was prior to my time, so I believe it was in 2018 from the information that I've looked at.
Could it be possible that there would be some kind of funding from a foundation or something like that that would pay for that so that we, the committee, could see comparables from other places like they did here with things that Scott was asking about with vacation and sick time and personal time like that? We could compare it to other places so that in the future, the board could see that. So like for next year, they would know. Do you think that would be possible to somehow do that?
I can certainly check. The other thing is I know that other health departments have done wage studies and they may have already collected that information and may be willing to share it.
That would be a good
which
idea
would
for
be-
next year because this is only 1 year. So
Right.
it might
Right.
make it easier for next year to do
Yeah.
that. That's just my suggestion.
No, it's a good suggestion for sure.
That's all.
Mr. Mapes.
I just had a thought, I think, a quick question. What percentage of our staff is hourly and others salary?
Oh, boy. Do you know that, Shannon? I think the majority is salary,
Salary.
right? And it's above a certain, so our classification scale goes up to 16 at the very top, and I believe it's everybody above, like 9 and above is exempt. FLSA exempt, Fair Labor Standards Act exempt, but I don't know the exact numbers of hourly staff. It's
So it's generally, I would guess probably department heads, maybe, or nursing or something like that. So are they the ones that get hurt the most by having to be on call, or is it generally staff people who are on call?
It's the executive team here that you're looking
Right.
at that's
Yeah,
on
that's
call.
On call.
Mhm.
yeah, and down to nurses and whatnot are on call too. And they are salary. Yeah, they're exempt. They're not hourly staff.
Okay, thank you.
Okay. Moving on to Program and Evaluation Committee. Mr. Chamberlain.
Well, I think we finally got some stuff together for the bylaws. Am I on? There we go.
You are on. Yeah.
Okay.
Yep.
So we did complete, everyone has put in a bunch of info in the program committee. And we do have a proposed motion. We did see if it passes, to have our lawyer review it. I don't know if anyone would like. to
Wouldn't
make-
that be putting the cart before the horse?
Well,
If we pass it, then it's a moot point to have our attorney review it, isn't it?
I think that's.
Instead of using the,
Authorize.
yeah, you would put in there contingent on, then it doesn't have to come back unless it's some major discrepancy.
That's what we do at our county. So unless the attorney thinks there's something wrong, it doesn't have to come back to us if we approve of it.
Okay.
So I think I would just change the motion in there. And I think the one I gave a copy of new motions to you, Commissioner Chamberlain, and I would strike pending and put contingent on.
Would anyone like to make the motion?
Go ahead.
I have different wording in,
Okay.
in the motion.
you
that
have-
I'm
Yeah,
looking at.
they gave us a
So-
new one.
Okay. Go ahead and make your motion.
All right, I will move to approve the amended Health Department of Northwest Michigan Board of Health bylaws and rules of order with edits proposed on 7/2 of 2024 constituents upon our legal review.
Second.
Okay. Motion and second. Any further discussion, Ms. Levan?
I have a lot of things that I would like to bring up. Under Article 1, under membership. It says in rare circumstances, temporary alternative members with full voting authority may be appointed by the respective chairman of the County Board of Commissioners. And I would like to take in rare circumstances taken out of there because it sounds like who's going to decide that? And I understand that that was a different, unusual circumstance, but if you take that out and read it, it says that temporary alternative members with full voting authority may be appointed by the respective chairpersons. And I know some counties have alternatives and some don't. So I don't know, that to me does not sound like a major issue, but I think it would be too confusing of who gets to make that decision with that in there.
So your recommendation is to strike the wording
In
in
rare-
rare circumstances.
Exactly.
I think that makes correct. I think that's correct. Or I would be in agreement with what you're saying there.
Yep.
Okay. The next thing I have is says under officers, the Board of Health will have the following officers. And I would like to put elected in there so that people know we have to elect the chair and the vice chair here. It does not say appoint, it does not say elect. It doesn't say, and I think that elected should be added there. I don't know if that's,
You're talking about we'll have the following elected officers inserted there.
yes. I
Okay.
think that's important. And I think there should be a sentence after that that says what the chairperson and vice chairperson should do. And I'm just going to read what I have. It says the chairperson will conduct Board of Health meetings according to these bylaws and rules of order. And the vice chairperson will conduct the meeting in the absence of the chairperson so that there is no confusion of what their responsibility is.
I'm not in disagreement with what you said. However, I think currently most public bodies operate under Robert's Rules of Order.
Correct.
And
It
I
just
think-
doesn't say that in here.
Well, I know,
anywhere.
and it didn't say that in your amendment, so I'm wondering if you want to include that in your proposed amendment.
Yes, I
Can-
think that this should be put in here so there's no confusion of people who don't know Robert's Rules of Orders. And I read on and there's
Well,
nothing
what
in
I'm
here
saying
anywhere.
is, do you want to include that in your amendment that Robert's Rules of Order is specified?
We could. It could.
Mr. Thoreau.
Yeah, can I say something real
Sure.
quick? It is in the next section that says procedures for Board of Health meetings. And under number 2, it clarifies that.
Oh, it does
So-
under Open Meetings Act.
Right.
Robert's
Open
Rules.
Meetings Act and follow the guidelines of Robert's Rules of Order.
It does
So
say
if you
that.
say that, that conduct the Board of Health meetings according to these bylaws and rules of order, it is essentially
correct.
covered.
Yeah, so we don't need
Yeah.
to add that then, Scott. I just feel that that was important there in case somebody was not aware
I
of
mean,
that.
It could be restated. I mean, that doesn't hurt.
Well, I don't think her amendment, including the chairman operating under the Robert's Rules of Order, hurts either. It's just a restatement of, I mean,
Right.
it's a duplication, but it's not, it doesn't change the spirit of the document.
And then the next paragraph, I thought was really
Um,
kind of wordy and confusing.
Before you move on there,
Oh.
Dawn, if I can interrupt you.
Sure.
You want to include language on the vice chair's role?
The chair and the vice chair.
Well, okay, so you addressed the chairperson. Do we want to include a statement in there that the vice chair shall act?
I'd have the vice chair will conduct the meeting in the absence of the chairperson.
Okay, and would the vice chair also have the authority then to sign any documents?
That's a good question. I don't know, Dan.
Yes, we have done that in the past. If the vice chair is here in the
But it should
absence
be
of the chair.
specified in,
That would be good.
in the
So let's add that. What should we
bylaws.
say?
Okay. So just to be clear, what you had said, the chairperson will conduct Board of Health meetings according, do we want to say the Open Meetings Act and Robert's Rules of Order instead of the bylaws?
Sure.
Okay. Okay.
And
Again,
then,
I guess I have an issue with that because it states all of that in Article
3.
4, Section 2.
Yeah.
It already states that it will follow Robert's Rules of Order and all that. I don't understand why you'd want to be redundant and add more wording. It's just doesn't make any sense.
No, I think it should just say the chairperson will conduct Board of Health meetings according to these bylaws and rules of order, because the bylaws do state the Robert's Rule of Order in the next section. And the Rule of Orders is pages after this. Correct?
yeah, I don't see it to specify those, the
Well,
chairperson and vice chairperson's responsibilities. I don't see it as being harmful to the document.
And it's
No,
not
it's
very
not
much.
like-
It's just a sentence,
Okay.
just so that people are not confused. The next paragraph thought was very confusing.
Hold on one second. I
ahead.
just want to make sure I get this right. So the chairperson will conduct Board of Health meetings according to
these
the Open
bylaws.
Meetings Act.
No, according to these bylaws,
Oh, okay. So we're,
according to the bylaws and rules of order.
okay.
The vice chairperson will conduct the meeting in the absence of the chairperson and also sign.
And also, well,
How did you want
okay,
that worded?
so I think where the confusion is coming in is that we initially said that you would specify the chairperson would conduct the meetings in accordance with these
These bylaws.
bylaws and Robert's Rules of Order. That's
No,
what-
the
okay.
rules of order.
Well,
That's
then-
these pages back here. These rules of order that are attached.
Okay, that's where the confusion is coming in,
Okay,
because initially we did say to specify Robert's Rules of Order.
but that's in the next paragraph right here.
I
that says
understand.
that.
So if you change what the chairman's responsibilities are under Article 1, or if you specify under Article 1 that the chairperson operates under these bylaws and rules of order, but don't specify under Robert's Rules of Order, I think there's
So you think you should
area
do
for
them all?
confusion.
Is that what you're saying? They should be all? That's
I-
maybe a good question for the attorney.
That's why we
Okay.
have attorneys review this stuff.
Right.
If it's necessary or not. How's that sound?
I'm good with
Okay.
I'm until the attorney reviews all this, I'm not interested in voting on it, to be honest with you. We have to have a clean copy of what we're going to vote on.
Okay.
Okay, well, I could get the rest of this stuff out.
Okay, the next one was still under officers and it was the next paragraph and I thought it was very confusing. So I changed the wording and see if this makes sense better. The appointments to the Board of Health are approved of by each of the 4 county commissioner boards, Antrim, Charlevoix, Emmett, and Otsego, usually at their first meeting of the year. The respective commissioners appointed to the Board of Health then vote to elect a chair and vice chair with committee appointments by the chair at the first regularly Board of Health meeting. To me, it made more sense of the designated order of how we do that.
So,
Do you want me to read the old one so people can understand?
well, right now it says all officers, where what's proposed in the draft is all officers will be elected at the first regularly scheduled meeting following the appointment of board members by the respective county boards of commissioners. These appointments are generally made after the seating of the new boards of commissioners at the first meeting in January. So I know in the past, we've not had January meetings because we have new commissioners that have yet to be appointed.
That's why I rewrote it.
Right. So I think, I definitely think we need to, what was your proposal again?
Okay, mine says the appointments to the Board of Health are approved of by each of the 4 county commissioner boards. And I have Antrim, Charlevoix, Emmett, and Otsego, that's in our district, usually at their first meeting of the year. Because everybody has a different date.
Mm-hmm.
The respective commissioners appointed to the Board of Health then vote to elect a chair and a vice chair with committee appointments by the chair at the first regularly Board of Health meeting. It's the same thing, just reworded to make
Right.
it cleaner.
Mapes.
I guess it all says most of that in the next article. In my mind, there's really nothing wrong with what it says right here, when you've got all that other stuff added over here.
You mean in Article 3 quorum?
You know, Article.
Oh, you're talking about Article 4?
4 talks about the organizational meeting of the Board of Health. Beginning at each year in January, February, the chairperson and vice chairperson shall be selected. So this is the cart right here, and this is the horse over here. I don't see anything wrong with the wording that's there. It provides what it needs to get us to Article 4.
So you're saying we should take that paragraph out under officers?
I think just leave it alone.
Well, it is left alone. I just reworded it.
Well,
I didn't
know,
I didn't
think
change
this
anything. I
wording
just reworded it
is
so it wasn't so
I think
confusing.
It's fine, because everything that you asked for is over here in Article 4. That's all I'm saying. I think it's becoming a little more difficult than it really needs to be at this point. Is it just me?
Well, I don't know. The old one says all officers will be elected at the first regularly scheduled meeting. What officers? The board officers, the county board? Who,
The
what does
two
that mean?
officers who are specified in the,
You said it.
Line above.
I'm not looking at the old one.
Well, that's what I was looking at. I just reworded this old one and now you're saying this is right here. So why should we have that here?
Why are you looking at the old ones when we just completely rewrote them?
No, this is what we're looking at right now. Under officers, this is what we're looking at,
Board of
whether to
Health will
approve of
have the
this.
following officers, chairperson and vice chair.
But this is in this is in here. I didn't get rid of this. That's still there.
I know, but why add all that other stuff to it?
I'm not adding
when
it.
it's all-
I'm not adding it.
What are we talking about?
Don, what I'm doing is I just rewrote this paragraph, so it's not confusing of all officers, who officers, the county officers, the county board of health officers. It doesn't specifically
no,
designate who they are.
well, but it's addressing the officers of the Board of Health. And in the line or the paragraph just above it, it specifies the chairperson and vice chairperson.
Mr. Chair, it is implied, correct?
Yeah, I think that.
It's fine. I,
following
this
the
was
same
my
thought.
suggestion. It doesn't matter.
Okay,
So, Mr. Chair, do we need to make a motion to table?
Well,
No, we're working
I
on
don't think
this.
she's done yet.
Oh,
let's get the information out so we can get it done. If we're gonna do that, then we can approve it at the next meeting.
Right, after review by an attorney.
That was the only things I had.
Okay.
That's all I had.
Anybody else have any proposed changes to the bylaws draft here? Okay, so I think, Mr. Mason, I think prior to
move to
tabling, I
table.
think we need, well,
Okay.
I think prior to tabling, we should make a motion for this to be reviewed.
You got a motion on the floor first.
okay.
Did we have a motion?
Yeah.
You did in a second.
Okay. Well, we've had lots of discussion then.
Well, yeah, I mean, the next, you'd have to table the motion.
Mel, can you restate the motion, please?
Well.
It's the one that's in the packet.
Right here.
Only is contingent on legal review.
Josh had it. Read it, Josh.
So Mel's got it now.
I move to approve the amended Health Department of Northwest Michigan Board of Health bylaws and rules of order with edits proposed on 7/2/24 contingent on legal review.
Okay. All right, that's the motion. It was second. Is there any further discussion? Hearing none, can we have a roll call, please, Mel?
Commissioner Chamberlain,
Yes, no.
What?
Aren't we redoing it?
It's confusing.
It's contingent on legal
Oh,
A
review.
contingent on legal review.
That's the motion, is contingent on legal review.
All right.
Should we add my suggestions to that? So the attorney can check on?
I'll add those.
They are added.
Okay.
There you go.
Okay,
So we are adding them now.
okay.
Yeah, yeah. go.
Okay, can I redo that? to
Well,
yes?
I guess just to be clear, I added the one,
The chairman.
about the
is
chair,
from-
yeah, the chairperson and the vice chair. And whether or not we should have Open Meetings Act and Robert Rules of Order in
Correct.
that paragraph. But the next one, I guess I'm not clear where we just
I think they said
just
it was
left it.
fine.
Okay, all right.
So
So
are we voting? is there
With
a
the
motion
changes?
We're
as
voting,
Written right here?
no, it's contingent upon legal review.
Okay. Okay,
So
with
our
no-
attorney has to look at this
so with
before
no
we
change- So with
finalize.
no changes with what we're looking at.
No, there was
No, there
a
are
few
changes to
changes
what
that
we're
I
looking at.
Well,
suggested.
see, that's where I'm confused because what exactly are we changing again?
Dan just said, read again, Dan.
So under officers, Article 2, it says the Board of Health will have the following officers, chairperson and vice chair. And then basically the addition would be kind of specifying what
The
they would do,
responsibilities.
right? The responsibilities. The chairperson will conduct Board of Health meetings according, and what Dawn had originally said was to these, according to these bylaws and rules of order, that's the name of the document. I know we were probably getting confused about Robert's Rules of Order and
Correct.
rules of order. So that's the name of this document, which was not changed. That was the original name on the, the bylaws that are currently in place right now. So just to point that out. So the question is, opposed to the attorney is, do we want, is that good enough? Because we specify under Article 4 that Robert's Rules of Order are followed and the OMA. Or do we want to add it here and get his opinion?
Okay,
So,
this is getting worse. It's not getting better.
okay.
Okay, so I'm we have a motion on the table. Unless you want to rescind your motion. I'm going to suggest that we get a clean copy with the proposed changes and that we have a clean copy, not this bit of confusion that's going on because we don't know what we're voting on.
Okay.
I thought I knew a minute ago and then that changed. So let's get a clean copy of the document.
Make a motion to table it until the next meeting, until we can get
We
that
have
done.
a motion and a second right
You
now
can-
that,
You can move to table that motion.
Yes.
Yeah.
okay,
Move to table the
I'm-
motion.
I
Yes.
will make that motion to table that motion so that we can have a clean document.
That's how it has to be done.
And it's
Yeah.
seconded by Mr. Mapes. All in favor, say aye.
Aye.
Any opposed? Good, thank goodness.
So confusing.
So confused.
FOIA procedures and guidelines, Josh B. Short.
Well, I was gonna hand this one over to Dan.
Okay. Mr. Thrall,
Yes. This should be fairly straightforward. So the reason that, we're looking at these documents is because we didn't have these documents, on our website. And looking through, we get a Freedom of Information Act request, and it was a pretty large one. And we were looking at our ability to charge fees to fulfill that request because it took a lot of staff time. By looking through the law, we realized we didn't have, the, guidelines, FOIA procedures and guidelines on our website. We didn't even have the document, specifically for HDNW. So simply those documents were created. They were, basically, from a template from the Michigan Township Association, which, Grand Traverse County also uses. And so we just took that template and, inserted our, information in that. So there is the procedures and guidelines, and then there's the summary of procedures and guidelines, which they almost look identical, but it's a requirement of the law. Okay, so that's why those are there. And because the Board of Health has some skin in the game in these documents, meaning that you would hear appeals to costs or denials, that I want to make sure that that the Board of Health was able to take a look at this and weigh in if you had any concerns or questions, and then also ultimately approve these documents. So we can get them posted on our website, and then we can be compliant with the FOIA law, and we can charge fees if necessary. We typically, just regarding fees, because the paperwork is somewhat onerous, we typically don't charge fees, for anything that is less than a half an hour, let's say, to fulfill the request, because it would take you that long to fill out the paperwork. I mean, it's just, yeah.
Mr. Van Alstyne.
I would like to make a motion to approve the Health Department of Northwest Michigan's Freedom of Information Act procedures and guidelines and the summary of procedures and guidelines.
Motion and second. Any further
I-
discussion?
I just have one question. Who's your Freedom of Information Officer that does this?
Well, I am as the director of the department, the FOIA officer, but I also have a deputy officer, which is
That
Jeremy.
could do it.
Yeah, which is Jeremy Farouk, and he pretty much handles the FOIA requests
Okay.
with the help of staff. Melanie actually also, we have a specific email address called FOIA requests@nwhealth.org. And, we have that on our website, and FOIA requests come in, and then that is monitored. So if one's on vacation, it's still being monitored, that type of thing, since we have, 5 days to respond.
Thank you.
Any other questions? All right. Can we have a roll call, please, ma'am?
Commissioner Chamberlain,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Hinkins,
Yes.
Commissioner Levanway,
Yes.
Commissioner Mapes,
Yes.
Commissioner Mason,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Turnbull,
Yes.
motion carried.
All right, that moves us to unfinished business. We have none. Moves us to new business. We have none. And that moves us to public comment. Ladies and gentlemen, again, you'll have 3 minutes to address the board. We ask you to step to the podium, state your name and where you reside. You'll have 3 minutes, and I'll give you a friendly reminder at 30 seconds left. Would anyone like to address the Board of Health? All right, hearing none, public comment is closed. Moves us to commissioners' comments. You also have 3 minutes.
Wait, she was,
I'm sorry.
Danica was going to say something. You
Okay.
did a great job.
Thank you.
Thank
Yes,
you.
Thank
great
you.
job.
That then moves us to commissioners' comments. Mr. Van Alstyne. Nope. Mr. Mason,
None.
Mr. Turnbull.
So until everybody have a happy Independence Day. It's coming up. Be safe and hope everybody has a great 4th of July.
All right, thank you. Ms. Levanway.
No comment.
Mr. Mapes,
Nope, good.
Mr. Aaron's,
All set.
Mr. Chamberlain.
I'm good now.
Okay. Happy 4th of July. Take a motion to adjourn.
So
Make the
moved.
motion.
Second.
All in favor?
Aye.
Thank you.